This week, the Central East LHIN presented its clinical service plan to Durham Regional Council. Central East is the first LHIN to move forward with such a plan. The initial plan focuses on 5 key areas, identifying which hospitals will be the so-called Center of Excellence for these services. They include cardiac services, maternal child youth services, mental health and addictions, thoracic surgery, and vascular surgery.
Every hospital cannot have every service. They don't today. They won't in the future.
The plan also gives general indication of what services will be delivered at every hospital, in regional centers, community-based agencies, and which specialized services will be available from 1 or 2 locations province-wide.
Will the Bowmanville Emergency Department close?
My expectation would be no.
The more contentious issue of emergency departments will be left for a future date. Concern is growing amongst smaller hospital sites, such as Lakeridge Bowmanville, that their ERs could be downgraded to the status of an urgent care facility.
As a regional councillor, I'm concerned about the overflow that will come to Oshawa as well with any problem that we have, or the overflow that will end up going to Cobourg or Peterborough, because a paramedic's going to have to decide where he goes. And when we pull an ambulance out of service, and that ambulance ends up in Cobourg or Peterborough, then we lose part of the service for the rest of the residents of the area they're in.
Brian Nicholson, an Oshawa councillor, was concerned that the public had been consulted only after the final recommendations of the clinical service plan had been drafted.
Why would you reach your solution before you went out to the public to ask them what they wanted? So why would you present the solution from your committee before you consult with the public on service vision? I haven't heard anybody in Durham saying why they're doing it. Concerns around the plan are likely in the details the public has yet to see. The LHIN will be consulting on this initial draft of the Clinical Services Plan until April 19th. Members in the Durham region are encouraged to read the draft online at the Central East LHIN site and respond in writing.